All right, if you have ever looked up the dosing of Toradol, of ibuprofen, of any of these meds, you may see on UpToDate a little name that says, Dr. Sergey Motov in this study said we should use this dosing. So introducing to you all Dr. Sergey Motov, he's our research director at MIMO. He is formerly a MIMO grad as well as one of our former APDs. He focuses on ED pain management. If you haven't been to the website painfreeed.com, it's awesome. The amount of content on there is insane. I will pass it over to Dr. Motov if you want to get your slides up.
While you queue up your slides, Dr. Motov, just a couple of housekeeping things. We cannot see you, we cannot hear you right now, so if you want to make fun of Tim and me, we won't even know. Also, the Q&A is open, so if you have any questions, Tim and I will be monitoring that. If you have a specific question for one of the panelists who just presented and it's just burning, we'll give you the opportunity to ask that right after the presenter talks. But then aside from that, we'll have Q&A after all of the panelists present, and you'll have another opportunity to ask questions there.
We will stay on until you guys are questioned out. All right, Dr. Motov, off to you.
Perfect. All right, good evening, everyone. Sabina, Tim, Eric, thank you guys so much for putting this together. And of course, I'm thanking my fellow colleagues, my fellow panelists who are joining us today. Welcome to all prospective candidates. You guys have chosen to join the webinar of the best EM residency in the world. And if not world, it's probably the country. Why I'm saying this, as a PGY 20 with 18 years spent at Maimonides, I can tell you for the fact that this is one of the best places on earth. Thank you, Tim, for this great introduction. My name is Sergey Motov. I am an attendant at Maimonides Emergency Department. I am a research director, and I have a passion or niche when it comes to safe and effective pain management. And for the next 7+ something minutes, I'm going to give you a brief description of our research division, what we do in our department, and we touch bases on some of the pain-free stuff that we have accomplished, are doing, and will be doing in the future. So when it comes to our research division, I'm proud to tell everyone that we have very, very robust team of researchers, and this is a basically graphic representation of it. As I mentioned earlier, I'm the director, and I have amazing research manager who takes care of everything else. We have a bunch of associates, 1 senior associate, 5 research associate, 3 research fellows. We have 30+ volunteers, and we have several part-time research administrators working with us as well. Each of the respected people are responsible for a variety of research-related activities. Some of them are for grant writing, some of them for industry-sponsored trials, some of them are for manuscript preparation and submissions, and the list goes on and on and on. And the best part of this particular team is that we're very, very eager to work to help with our junior faculty and of course with our residents. When it comes to research, we have a fair amount of subdivisions within the department, and to my great happiness, I can tell you all the subdivisions, they do some when it comes to research. Ultrasound, which my amazing colleague, Dr. Haynes, will elaborate further, but focus on some pain stuff, on some cutting edge TEs, and list goes on and on and on. Dr. Aguirre will tell all about simulation research, which has been phenomenal for us when it comes to overall structure of the department. MedEd, under guidance of our PD and APD and our amazing graduate from med education, Dr. Cueva. We do a fair amount of quality performance and improvement stuff, departmental, interdepartmental, even the hospital level. Some stuff in pediatrics, of course, ultrasound related, pain management related. EMS, Dr. Freeman will tell you more about event medicine, some pre-hospital pain management stuff that we are researching as well. Pain management, primarily focusing on safe and judicious opioid use, on non-opioid analgesia, and some of the potential work in the future, which Dr. Sherry will elaborate when it comes to opioid use disorder. We've, as everybody else in this country, we've been pursuing some COVID-19 related research, and we've done a fair amount of data mining when it comes to the things, and certain things are in a process of being published. We do a fair amount of wellness, because wellness is very big in our department. We want to make sure our residents are well taken care of, as well as faculty. Focus on some geriatric stuff, specifically related to geriatric pain management and end-of-life care. We do a significant amount of industry-sponsored research, even though I can reassure you it has nothing to do with the ethic of research. Those primarily related with respect to biological testing or lab testing. They're not really geared towards any particular medications as of yet. We are collaborating with interdepartmental folks who are helping us from Department of Trauma, Orthopedic, Internal Medicine, and list goes on and on and on. All right, when it comes to research education, I can tell you and attest, because I've been through this myself, it's incredibly painful to teach research. And after many, many years of trying what's work, what doesn't, we came out with a asynchronous learning model when our residents are given sort of reading assignments over duration of their residency. They read at their leisure, they have self-open book quizzes, and they just meet with the research director twice a year, and we just follow their prospect. It's very laid back, very encouraging. And because of it, I think our residents are very successful when it comes to their accomplishments. They get to present their work at Maimonides Evening of Research. They get to travel. Well, now travel becomes obsolete, but hopefully not for a long time. They get to go to Lake Sagamore and present at New York chapter of American College of Emergency Physicians. They get to go to national conferences such as American College of Emergency Physicians Scientific Assembly, American Academy of Emergency Medicine Scientific Assembly, and Society for Academic Emergency Medicine Assembly as well. Now, when it comes to research engagement, when it comes to residents, from 2019, 27 residents had active projects, 20 residents had presentations, and 15 residents had publications. 2020 is not over yet, but thus far, 32 residents have active projects, 4 of them have presentations, and 8 of them already published papers, and we pretty much still got 5 months to go. So I'm incredibly proud of our residents, what they do, what they achieve, they perseverance, they push for science, and the way they approach research. So this is as far as the research goes, and for the remaining time, I'm briefly gonna tell you about pain-free ED. I am delighted to share this panel with all my colleagues, and everyone who's on the panel today are incredibly instrumental in our success of providing safe, effective pain management to our patients and adult, pediatric, geriatric patients who come to the RED. And the best thing about residency is we just give ketamine to everyone, pretty much no matter what you have. You're in pain, you get ketamine. You're not in pain, you get ketamine. If you're still waiting in the waiting room, you're probably going to get ketamine. But being a little more serious note, we are pushing for responsible opioid prescribing practices, same as a safe and judicious opioid use, particularly geared towards opioid stewardship. And these are the 4 main tendencies that we try to accomplish, which is number 1, patient-specific pain syndrome targeted approach. We are staying away from one pill fits all dogma. We are big on pushing combination of non-pharmacological, non-opioid, and opioid analgesics. And as I mentioned earlier, we have succeeded with utilizing ketamine in any form, shape, and dose. Nerve blocks, which Dr. Haynes will elaborate a little further, and list goes on and on and on. We're working towards reducing to the point of complete elimination of highly euphoric opioids, such as hydromorphine, oxycodone, and hydrocodone. And lastly, under guidance of Dr. Schreier, we've been successful enough to implement medication-assisted treatment for patients with opioid use disorder, as well as prevention of overdose.
I think it's worth mentioning, Sergey, that you shepherded an initiative that is pretty unique, which is that you removed hydromorphone from our ED formulary. Could you say I think even the residents on the call don't even fully appreciate sort of what that means and how that came about. And if you could just spend a moment like saying the effects of what that's meant for the department.
So I'm spending the moments, I'm just going to observe all the accolades and applause. Thank you, Dr. Schreier. But the point is, it's a team sport, remember? If anybody's seen the movie, my favorite movie, Accountant, it's a teamwork, old-fashioned teamwork, everybody in together. But yes, we've been fortunate enough to put together a pilot first and then actually protocol on complete removal of hydromorphine out of our emergency department. And as of this June, we have celebrated 4 years of hydromorphine-free ED. This is only first time. I don't usually like to use the word free something ED, but this is the one I'm actually going to use it. Thank you, Dr. Schreier, for pointing this out. We are hydromorphine-free ED. As of 4 years and as of 7 months or close to 8 months, we are oxycodone, hydrocodone, and tramadol-free ED as well. And this is thanks to Dr. Schreier. So on this note, I'm going to thank you for giving me this opportunity to share the light on what we do in research and pain. And I'm probably going to take questions at the end of the entire session. Thank you, guys.
Thank you, Dr. Motov. And it is
My
so
pleasure.
true what he says. Like, he's so encouraging with research and he's so innovative. It's really great working with him.